Hello everyone, I'm Samparna from Policy Bazaar. I welcome Dr. Harsh to enlighten us on the very good topic today. So, welcome Dr. Harsh, and over to you. You can start the session now. Thank you so much. I
Thank you, Sam.
welcome everyone to this session.
Thank you, Samparna, for the brief introduction. Welcome, everyone. I wish everyone is doing. I hope everyone is doing good. So, for today, the topic is neglected tropical diseases, and we'll be covering about these um, in with the help of the presentation. Within 30 to 45 minutes. Thereafter, we will be having a 15 to 20 minutes Q&A session where the panel will be open for complete full discussion. For whatever questions you have, you can either ask in the chat box or you can unmute yourselves and you can ask directly on one-on-one conversation as well. So without a further ado, I'll be starting with the presentation. Uh, in between the presentation as well, I've kept a quiz as well. So there will be one quiz, and I would request everyone to unmute yourselves so you can participate in the quiz. And I would be really happy if people can answer. Even if you can't, it's completely fine. Even if you answer wrong, it's also completely fine. So I'll start by sharing my screen initially. Samparna, please gives me a heads up if you are able to see my screen. I hope it is visible. Yeah.
Yes, Harsh, it's visible.
Okay, thank you. So for today, the topic is neglected tropical diseases, and we start with the quiz. So I would request everyone to unmute yourselves, and you can participate in this quiz. Uh, so what are these neglected tropical diseases? Anyone has any idea? What is this term NTD, neglected tropical disease? Anyone? Any? If somebody feels that they can like the chat box as well. So anyone? What does it make sound of neglected tropical diseases? We already know that is it's a disease, it's an illness. What about the neglected and tropical? Anyone? Okay, so I think nobody knows. Can you name some neglected tropical diseases? You must have gone through a Google search before coming to the session that what are these? What is the today's topic, isn't it? Or does anyone has any idea? Can anyone name some? Mm, so I think nobody knows. Anyway, let it be. So we will further, I'll continue with the presentation. So by the definition, neglected tropical diseases, these are the ancient diseases of the poverty. So these are present in the society since ancient times, and they are the disease of the poverty. So the people who belong to the impoverished society, they are the diseases of those. They impose a devastating human, social, and economic burden. So now you can understand why the poverty is linked, because a larger proportion of the Indian population specifically, or even the global population, belongs to the poverty, and that's why social and economic burden they impart to, and they cause like they have the impact over 1 billion people worldwide, causing some tropical as well as some subtropical areas which where the population are proportionately marginalized. So that is why these are termed as neglected tropical diseases. Now, why are they called neglected? Because the people who are most commonly affected by these diseases are the poorest in the world. And they don't have their own political voice, they don't have their own social or economic voice. And thereafter, they suffer the most from neglected tropical diseases. And that is why they become neglected, because they don't come under the strong political voicing area. So their treatment part, uh, their identification part, their diagnostic and management part, they are not very well highly prioritized, because the poverty line, they don't even seek the medical help as well. So that is why neglected part is there. Tropical because of the environment. So these diseases are very common in the tropical and the subtropical areas. And what are these diseases? Dengue, rabies, leprosy, Chagas syndrome, Guinea worm disease. So we will discuss it further as well. So these are the common neglected tropical diseases. And why government, like why the World Health Organization, WHO, wants government to do. So individual governments, specifically like Indian, China, African governments, why WHO wants to focus on entities specifically in these governments, because the people health and the well-being are very much important, and they are something which needs to be improved is overall general population health. And with the focus on NTDs, so WHO can ensure that within the next 15 to 30 years, so the global burden of these diseases can be reduced. And that is why this is being done. And how many advances have already been made? Colombia and Ecuador have become the first countries to eliminate river blindness. Even in India as well, we have eliminated yaws and prawn syndrome. So there are some diseases where every country individually, they are taking their part. They are taking, good decisions. They are taking some policies. They are making some policies to reduce, to eliminate or eradicate some of the diseases. We will discuss this in the further slides as well. Coming to the global burden of it, so 1 billion people out of the 9 billion people, 1 billion people around the world are affected. So that's a major population category which are affected. And 1.62 billion people require treatment every year. So affected means 1 billion people are getting affected, but there are some people, like let's say if you're getting affected and your family members are in your immediate contact, especially in the poverty areas. So those are like close knitted community, and there are higher chances of spreading infection. So we need to give treatment to much more people to cater to, so that it doesn't spread out much, it doesn't transmit much, so that we can cater out to the treatment part, to cater out to the targets part of the elimination. So 1.62 billion people require treatment every year, and 2 lakh deaths can be prevented every year. Out of 50 lakhs 50 lakh deaths, 2 lakh deaths can be prevented every year if we know, if we can work upon entities. Amongst Indians, 404 million Indians are at risk of contracting lymphatic filariasis. Around 500 million people are at risk of contracting malaria. Around 800 million people in India are at risk of contracting dengue infections. So that is why these diseases need to be focused upon. And so there are some, there are some organizations who are working upon them. So amongst the India, and there is MDA round which occurs every year, whose motto is Unite, Act, and Eliminate. Now, amongst all the diseases which are amongst the NTDs, which we will discuss in the next slide, that what are the diseases which are in the NTDs? 50 countries have successfully eliminated at least one of the NTDs. So amongst, like, let's say malaria, already US, UK, these countries have already eliminated malaria from their country. Not eradicated, but eliminated. So as we have discussed, Bangladesh also, Bangladesh have eliminated Bangladesh and Nepal are poised to eliminate visceral leishmaniasis. So leishmania is another infection. You must have seen that someone who is having their swollen up leg. So that is leishmania. And Bangladesh and Nepal have successfully eliminated those diseases as well. Although in India it is still present, but we have its own disease steps as well. So we have national program like NCVBD, National Control for the Vector-Borne Diseases. So these diseases comes under the vector-borne diseases as well, and where leishmania is amongst one of the diseases. So these are the common diseases amongst the neglected tropical diseases. So we can categorize it into multiple areas. So number one, amongst the bacterial, trachoma, leprosy, Buruli ulcer. Leprosy is nothing but what is caused by the TB, like the mycobacterium, the bacteria which is responsible for causing the tuberculosis. That bacterial variant, the tuberculosum tuberculosis leprosum that causes leprosy. So bacterial entities are there. Viral, we all know rabies, dengue, chikungunya, malaria. These all are viral. Then there are fungal as well, mycetoma, chromoblastomycosis, protozoan, helminth. Helminth means there are some infections which are worm based. So you must have heard at your home that not to eat this uh, green cabbage because they are rich in some worms. So the worms which are green cabbage has a cystic sarcosis if they are infected, of course. If they're not infected, then it's completely safe to take. So there are other infections like salt-transmitted helminthiasis, tiniasis, snake bite, envenoming. So these all are the parasites which causes some infection. So some sort of diseases in individual. So these are the common infections which are present in the India. Dengue, we all know it is caused by a mosquito. Dengue, malaria, Chagas, uh, yeah, dengue, malaria, chikungunya. These all are the infections which are caused by the mosquito. And when mosquito bite us, that infection gets transmitted into us if the mosquito is already infected with it. And let's say if I am having dengue or malaria, the vector, the mosquito basically, if it is of that type which can transmit the particular infection. So for dengue, it is Aedes mosquito. For malaria, it is Anopheles mosquito. So let's say if I am having dengue and another Aedes mosquito who is non-infections, they bit me, they suck out the blood. So they will get infection in their body. They can reproduce the infections within their body. And thereafter, whenever that particular mosquito goes to another person, they bite them, they initially inject their saliva into their skin, the human skin. That's how they transmit the infections, and that's how the transmission occurs of dengue, malaria, chikungunya. For other diseases like schistosomiasis, leptospirosis, Chagas disease, leishmaniasis, there are other organisms or other animals which are responsible. There can be 2 to 3 animals who can be responsible. So there can be vector. Vector means someone who transmits the infection to another person, who take the infection from one and transmits to another person. Then there are reservoirs. Reservoirs means who can only store the infection. So they, whenever they die or whenever we get in contact with them, so they can also transmit the infection. So for different diseases, they are the difference. Like wild mammals, like mouse, monkey. For some, there are dogs. Like for rabies, we all know that dogs, cats, monkeys are there. For leishmaniasis, we have foxes, we have dogs, we have mongoose as well. For other diseases like scabies, so it's a human contact within a human. So depending upon what kind of disease it is, so domestic reservoirs as well as the vectors can also be very different. Now we come to individual diseases. First of all, we talk about dengue fever. So dengue fever, we all must have heard about dengue. Dengue is very much common during the rainy season as well as the winter season. So dengue fever is caused by the Aedes mosquito. Uh, Symptoms: severe headache. You will feel that you are having pain. You will have severe headache. Specifically, you will feel the pain behind the eyes. So whenever you are feeling that there is some excruciating pain which is occurring behind the eyes and you can't even open your eyes, you just have to keep it remain shut. So that is how we diagnose that it might be dengue fever. Apart from it, there can be other symptoms as well. You will have generalized body pain, you will have lower back pain, knee pain, vomiting, nausea. All these are the common symptoms of dengue. Now, amongst the treatment part, so let's first do prevention part. So for the prevention part, you need to, whenever these seasons are coming, whenever you know that the dengue virus basically, or the Aedes mosquito, there is a mosquito season, or the virus is getting propagated within your surroundings, or you're getting to know that within your surroundings there is someone who is getting affected by dengue virus, or within the news you are hearing this, start wearing full sleeved clothes, completely covered up throughout your body, even while sleeping, using mosquito repellent sprays all out, something which is helping you prevent dengue. Even mosquito nets, which are zero point 0.5 mm of the zero point 0.5 micrometer of those of the diameter of the nets. So those can be used as well, and avoiding the stagnant water sources. So wherever you see that there is this stagnant water, that is the major cause of the dengue. Aedes mosquito can be propagated over there, and they can be carrying dengue virus, and that's how you contract dengue. So amongst the treatment part, let's say even if you get dengue, first of all, obviously consult your doctor, get a treatment properly. Whatever your requirement is, get blood tests done, get checked for the platelets. If your platelets are down, so you need to get some syrups or some antibiotics, something which will improve your platelet count. Otherwise, you need to get admitted to the hospital. Apart from it, you need to take complete rest. You need to take plenty of water, plenty of fluid intake. Paracetamol can be taken to reduce the fever. Even if the fever is not reducing, then wet sponging can be done. So all these are comes under the treatment part. But primarily, we need to focus on the prevention part, because dengue is something which can be prevented very easily by just home-based measures. So if you see that there are somewhere stagnant collection of water nearby your houses, which are fresh water specifically. So dengue virus propagates in the fresh water. So if you feel that there is something, let's say if there is some flower pot in your house, or even at the rooftop, you're keeping some mugs where the water is getting collected, and that is the open area. So you need to eliminate those areas. Next, we come to rabies. So before rabies, let's do malaria because it's quite interlinked with dengue. So malaria in India, usually almost 3 million malaria cases occurred in 2017. And if I say about 2025, around 2 to 2.5 million cases occurred in India in 2025. And what will be the common symptoms? Almost similar, but here the pain will be quite generalized. You will feel more pain in your back, in your abdomen, in your knees, in your joints. So these are the common symptoms of the pain. Then there can be fever, headache, vomiting, nausea, chills. You will feel that you're having, this fever is occurring, but you're getting sweating as well. You're getting chills as well. You're having muscle pain, side by side diarrhea. So all these are the common symptoms for the malaria. Now, individually, dengue and malaria, if they don't get proper treatment, if you're not reviewing a doctor and you are not taking proper treatment for these individual diseases, so they can cause some complications as well. So amongst dengue, there is dengue shock syndrome, which is very severe, where you need to land up in an ICU. You'll be put on a ventilator. A lot of fluids will be going into your bodies via your IV route. So to prevent all those complications, we recommend to go to the doctor, get hydrated as much as possible. Same in the malaria as well. So malaria itself can go to, like the malaria virus, can go to a lot of places, and it can cause other problems. Like if it goes to the brain, it can cause cerebral malaria. If it goes to the liver, it causes hepatic malaria, which causes liver failure ultimately. It can cause anemia. Individually, dengue, malaria, chikungunya, these three can cause anemia. So these are the common complications. Now, amongst the prevention, so for dengue, I have said that dengue virus get collected within the clean water, clean stagnant water. While the malaria, the malaria vector, Anopheles mosquito, they get propagated nearby to those areas where there is dirty water, where there is collection of water, which has been standing for a lot of time. Nearby rivers, nearby all those areas, chikungunya is very common. So you need to see whether there is some open drain around your house. So that is dirty water, which can lead to malaria causing vectors propagation. So you need to eliminate those areas entirely. Apart from it, whenever you are seeing same thing, whenever you're seeing that there's a malaria season, when there is a rainy season, so you need to start wearing full clothes, shoes, socks, complete wear, fully covered up, then putting on mosquito repellents, Odomos, some lotions, whatever you feel is completely okay to you. So that is about malaria. Now next comes to chikungunya. I'll just touch a few points for chikungunya as well. I have not created a slide just to cover a few points. So chikungunya is another disease which is spread by Anopheles itself, sorry, Aedes itself, which is the same vector which is responsible for dengue. But here the Aedes is of different type. So mosquito is of different type. So chikungunya occurs in the flowing, running water nearby the rivers, nearby somewhere where the water is running out, and the chikungunya vector, the mosquito gets propagated over there. So you need to prevent those areas. Again, the prevention is same, everything else is same. Amongst the symptoms part for the chikungunya, you will feel that you are having fever, you are having skin rashes as well. So chikungunya comes with skin rashes. The fever is also rising day by day. Body ache is also generalized. Nausea, vomiting will be there. In the chikungunya, the definite feature is the back pain. You will feel that lower back pain is very severe with the nausea and vomiting. That is a common feature of the chikungunya. Next, we come to rabies. Rabies is a viral disease again. It is caused by inflammation of the brain. So whenever there is a stray dog, stray cat, or maybe in a pet dog, pet cat who are not vaccinated, so they might have rabies virus within them, and whenever they bite or scratch, that infection, the even with a small scratch, let's say even if your blood hasn't come, but there's a scratch which you can see on your skin where there is a layer, the white layer which you can see has been rubbed off. So sorry, so even with those scratches or the bites you can get rabies. So if the dog, cat, monkeys, bats, raccoons, any organism who is infected with rabies give you a bite or scratch, so there are chances that you will get rabies. And immediately when you get those viruses, it takes some time. So during that time it proliferates. So let's say if there is just one bacteria, within 10 days it will be 100 of viruses. Sorry, it is a viral disease. So 100 of viruses will be there. Then thereafter it will proliferate and it will go towards the brain. And after reaching the brain, it will cause humongous inflammation in the brain, which can cause ultimately coma, death, paralysis in humans as well as animals. Now, just to tell you here, there is this one thing that I wanted to say. There are only two diseases in the world where death is confirmed. One is rabies amongst them. Another one is HIV/AIDS, where death is going to occur anyhow, anyway. But if you get rabies, I'm not saying if you get a dog bite, I'm saying if you get rabies, there is no further treatment available, no cure is available, and you will die eventually. So that is why we recommend, if there is even a small scratch, get rabies vaccine, get rabies immunoglobulins, whatever is possible, get it immediately done so that you don't contract rabies, even after viruses is there, so that you don't get rabies at all. Now, amongst the symptoms will be fever, headache, nausea, vomiting, which is very common. There is one peculiar symptom, hydrophobia. So, within my journey as a doctor, I have attended to, I think, hundreds of patients. And around 80 of those patients had this feature of hydrophobia, where there is a fear of water. Even while drinking the water, even while it is raining outside, or they had to touch water, or in some way they need to do. So whenever their mind is processing that, okay, there is water associated with my task, so they will immediately either get a fit, either get a seizure, or they will immediately get away from the exposure of the water. So this is a very common symptom which we have seen in the rabies. So amongst the diagnosis, I think medical history and something which will be eventually very important. Treatment, I have already said, no cure once symptoms occur. Wound cleaning is very important. I'll touch these points within the rabies guidelines part. And complications, paralysis, coma, and death. So this is eventually going to happen. Prevention, vaccinating pets. So if you see if there are any pets nearby your houses, nearby even at your household, just get them vaccinated so that even if they get in contact with a wild dog, wild cat, they don't themselves contract rabies and they can't transmit to you. So avoiding contact with the wild animals. So these are the prevention parts. Now, amongst the rabies guidelines, so one thing which we always miss out, I'll touch another point here about the snake bite as well. First, let's discuss the rabies. So one thing which we always misses out, which we always miss out is washing our hands or wherever there is a bite mark. That is really, really, really important. So let's say if a cat, dog, any animal who has scratched you or bite you, number one step which you have to do, open your tap, get your affected area. So let's say if my hand, this is my hand, and here I have a scratch mark. So what I'll do is I'll open the tap. Within those running tap, I'll take a I'll take the soap and I'll rub it continuously. The soap over with the running water, I'll rub over my hand continuously for around 15 to 20 minutes. Just by this action, I'll reduce the chances of getting rabies by 99%. Thereafter, I will go to the hospital, and once I go to the hospital, I'll get the vaccination. Within those vaccination protocol, we have post-exposure prophylaxis. So after it, once you have been bitten or you have been infected, we have a injection regimen, which is of 3, 4, or 5 days, depending upon which regimen you are taking. The good one or the government authorized one is the 4 one. So 0, 3, 7, and 28 basically. Just to mention the 0, 3, 7, 28 means, so today if you're getting a vaccination, thereafter 3 days you are getting a vaccination, then 7 days, and then 28 days. So this is how the vaccination is done. And after getting the vaccine, your chances to get rabies are next to nil. There are no chances, even after you have been bitten by a wild dog or cat who is already who's already infected with the rabies. So these are the things, and so these are the common prevention which I have already said to make sure your pets are vaccinated. Leave wildlife alone. Don't touch wildlife. Don't let your pets roam free or get into contacts with the wild animals themselves. So these are the common things. Now, another thing related to the rabies. Now, I want to talk about snake bite. So, since I have done my studies from West Bengal, Calcutta, and there I have seen during my internship time that there were a lot of patients. Like within a single day, I used to attend around 20, 30 patients who were bitten by snake. And the common practice with the snake bite. So let's say if a snake has bitten me over my leg. So what people used to do is they used to tie it like above the area of the bite. They used to tie some clothes, something rope, something over up above that area, which is highly not recommended by us. I mean, that is something which we at all don't recommend. Immediately, whenever the snake bites, the infection is already there. So after tying that up, the rope or something, any cloth, you are causing nothing, but you are causing the less blood to go into that area, which can ultimately result in necrosis. Necrosis is nothing but the black leg. So we don't recommend it at all. Secondly, there is another practice which I have commonly seen that people, like even in the movies, they depict. If a snake has bitten you, you just need to suck the blood and then throw it away. Nothing. Please don't do it like that. That person is infected and you are also infected. So nothing to be done. If there is a snake bite, you can immediately you can immediately go and wash it under the water, not even with the soap, just plain water. Thereafter, immediately go to the hospital. Panic shouldn't be there. 90% of the deaths in India due to the snake bite occurs because of the panic, not because of the poisonous snake. So you need to make sure that you are not panicking. If a snake bite, is going to be completely okay. We have management. We can make you turn around it. But if you are panicking, then we can't have anything. So 90% of the deaths, because the snakes are not poisonous and their fear just takes them into those areas that we can't even bring them back. So fear is something which is highly relied upon. Now we come to soil transmitted infections. So there are some infections which are transmitted via soil, like teniasis, cysticercosis, which I have said via the cabbage, teniasis via the pork, via beef, if they are infected. So there are other infections as well, helminths. So these are the common soil transmitted infections. And what we need to do is whatever is coming to our house, let's say fruits, vegetables, we need to clean it. We need to wash it with a safe and clean water. Secondly, we need whenever we are going to the washroom, we need to sanitize our hands, clean our hands completely, specifically before and after using toilets, before and after eating food, both the times, using sanitary toilets, not using areas which are the public areas where there are not sanitation is not properly managed, and wearing slipper and shoes. So there are some infections like ankylostoma and calaris, where the organism. So some people have this habit to walk barefoot early morning on the grass, so that organism can get uh, into the soul basically, and they can directly affect the liver, the gut as well. So always wearing slipper and shoes, and eating properly cooked food. This is very important. If you are eating the raw food, uncooked food, then you have good amount of chances that you are getting soil transmitted infections. Apart from it, there is this National Deworming Day. So, if you have any pregnant women, if you have any child at your home, so specifically in the areas of Bengal, Bihar, Jharkhand, Chhattisgarh, and the north area, Haryana, Punjab, Delhi, all these areas, they have this program within their within their state systems, rather, I would say, that they have to be dewormed completely. So deworming is something which we give to every individual, every pregnant woman, to prevent any infections to themselves as well as to the baby. So the deworming is something which we give a tablet for 1 day, thereafter 14 days after, and that's it. So please make sure that you are getting dewormed. Now we come to, this is the last one, because it's also very common in Bihar, Jharkhand, Chhattisgarh area. So if you are traveling to those areas, so there is this infection which is lymphatic filariasis, which we also called as elephantiasis, where the leg or the hand, they become swollen up. They become like an as of an elephant, and that is why it is called as elephantiasis. The vector is a Culex mosquito, which is again a mosquito. Culex also causes other diseases as well. So lymphatic filariasis is the one of them, amongst one of them. The common features will be fever, headache. Now, why this swelling occurs is because of the lymph nodes blockage. So we have lymph nodes within our complete body, where the lymph node helps to take the water out of the areas and to transmit it towards the heart. So if there is some problem within the lymph nodes, so the swelling occurs naturally. And here the lymph nodes are completely blocked. That's why elephantiasis occurs. Prevention, again the same, using repellents, nets, preventive clothing. There are drugs as well, antimalarial drugs. If you know that within your society, if there is someone, then you need to go for antimalarial drugs as well. So overall, here is how you prevent them. So these are the common things which I have told in general. Spraying insecticides, using mosquito nets, removing standing water, sleeping under bed nets, and seeking treatment to reduce infection. So let's say even if in your family, if somebody is infected with any kind of these infections, so you also need to take some tablets as well. So for the diseases like, yeah, so for the diseases like helminths, some of the diseases like lymphatic filariasis, helminthiasis, echinococosis, then fungal diseases, scabies. Uh, for these diseases, you also, let's say if your family member is having some problem, you also need to take the preventive measures, preventive treatment as well. So infectious disease candidates for elimination by 2030. These are the common diseases which India as a whole, as told by WHO, is targeting to go forward with the elimination. So amongst the elimination, the common ones is the malaria, where we have made the target for 2030, but now we are increasing the target towards 2035. So malaria is something which is very important. Filariasis, schistosomiasis, leishmaniasis, leprosy. Leprosy, we have attained a very good results in this. Like as far as I can remember, 10 years back from now, the load was around 0.1%. Now we have nearly come down to 0%. Nearly. I'm not saying completely eliminated. We are on the verge of eliminating leprosy as well. Soil transmitted helminthiasis as well. So these are also, we are on the verge of getting them eliminated. So why did we discuss the topic today? Because the 30th Jan is World Neglected Tropical Diseases Day. And it's very important to discuss about these diseases because they are around 15% of the world's burden of the diseases. So that is why it is very important to discuss about these. So I hope that you have understood, you have grasped a good knowledge about these diseases, and you will now do whatever is required to maintain your health as well as in your surroundings. So I wish you all a happy World Neglected Tropical Diseases Day. Make sure that you are staying safe and healthy, and as well as your family. Thank you. Now I'm opening the panel for any questions. So if you have any questions, please feel free to ask. You can write in the chat box as well, or you can ask me one-on-one as well. You can just unmute yourself and you can ask. Any questions, anyone? Was I so good that you don't have any questions? I mean, I really don't, I really doubt that. Anyone, any questions? So I think there are no questions since I can't see anyone unmuting themselves. So any which way, Ria, can we conclude the session?
Yes, we can.
Okay. So thank you so much everyone for joining in today. It was really lovely to have you all here to tell you about these diseases. And I really hope that you will also spread the awareness about these diseases within your society, within your family. And I wish you all a happy World Neglected Diseases Day. Wish you all a good health as well. Please make sure that you are maintaining your surroundings really well. And thank you.
Thank you, Mr. Harsh. It's a nice presentation. Thank you.
Thank you. Thank you so much. Thank you. Thank you and take care.